Today's the ULM College of Pharmacy Advocacy Day at the Capitol. We have about 18 students here today, and our purpose is to advocate both for the profession of pharmacy and for the College of Pharmacy itself, which is the only state-supported College of Pharmacy in Louisiana. ULM's College of Pharmacy is the only state-supported school. It was founded in 1956, and the main campus is housed in Monroe, but we also have satellite campuses in both Shreveport and New Orleans that house primarily our fourth-year clinical students and faculty at those locations.
Our booth is immunization. And immunization is super important because as pharmacists and as pharmacy students pursuing to be a pharmacist, immunizations are something that we can provide to the general public. And since pharmacists are super accessible healthcare professionals, we can provide those vaccinations to the public and just kind of inform you about what is and is not the best vaccination to get at the time, especially with COVID going on right now. It's just super important to stay informed about all these issues.
Why do you want to become a pharmacist?
Honestly, when entering LSU, I went to LSU for undergrad, and when entering LSU, I wasn't sure exactly what I wanted to pursue, but I knew I wanted to do a healthcare profession. And after getting a job at a pharmacy in the area, I decided that pharmacy is what I want to do, and it's because I love the interaction of patients coming in, and you're able to see these patients 12 to 15 times a year, depending on if they get their prescription filled every month. And that was super important to me, to have a super close relationship with the customers coming in and just be able to talk with them and really sit down and get to know them on a more personal level.
What are your plans after graduation?
I worked in a community pharmacy in undergrad, and now I work in a hospital, and honestly I really like both of them, so I don't have a yes or no whether I want to do retail or hospital. But as far as right now, I hope to move back to New Orleans, where I'm from, and hopefully get a job at a local hospital, and if not, maybe a community pharmacy around there, because I really enjoyed both jobs that I've had so far.
Today we're here to promote vaccines to people. Obviously in the light of COVID, we also want to recognize other diseases that we can prevent.
What would you say to people that are hesitant about getting the COVID vaccine?
I would tell people to do their research. We want it to be a very personal decision, but the research backs up that it is a good idea to get the vaccine, and so we're here to provide it to people.
Why do you want to become a pharmacist?
My dad is a pharmacist, and so he's been a big inspiration to me.
What have you learned at the College of Pharmacy at ULM?
I've definitely learned how to be a better clinician, a lot of fundamental skills, and so just being able to provide patient care the best way possible.
What are your plans after graduation?
I plan to go work in a retail setting, that way I can be accessible to the community.
My booth is about smoking cessation, and it's extremely important because smoking can cause a wide range of health difficulties. It can affect your lungs, it can cause cancers, affect your heart, your eyes, your bones, it can cause osteoporosis, and so there's so many aspects in the world of pharmacy to help you stop smoking, like lozenges, gums, patches, and even some RX products like Wellbutrin and Chantix that you can get on to help you quit smoking. It's very important. So I'm from Pineville, Louisiana, and I came to pharmacy school at ULM because I really love the healthcare profession, and pharmacists are one of the most accessible healthcare professions in the state of Louisiana and in the world, and so I really like that aspect of it.
What have you learned in the College of Pharmacy?
Oh, so much. We learned so much about drug therapies, drug side effects, drug adverse effects. Anything you want to know about drugs, we're there to tell you about it.
What are your plans after graduation?
I hope to, after graduation, hopefully get accepted into a residency to become a clinical pharmacist, which means I get to work in the hospital on rounding teams and on more drug therapy teams to better help the patient.
Pharmacy career is a great career to have. There are many different options that you can go to with a Doctor of Pharmacy degree. The demand of pharmacy is still real high. There's a lot of turnover in the pharmacy area. Older pharmacists are retiring, and so younger ones are moving in. So we're supplying pharmacists to the state of Louisiana and other states.
My booth is on diabetes, and we're here to educate the public about how to manage diabetes as well as recognize symptoms of diabetes. This is a very important disease state for pharmacists in that we help educate them on how to monitor their glucose and what to do when it's too high or when it's too low.
Tell us, why did you enroll in the College of Pharmacy?
Well, I've always been fascinated with the healthcare environment, but I've always just liked the chemistry aspect of it all as well. So it was just kind of a match made in heaven.
What have you learned at the College of Pharmacy at ULM?
Well, I've learned so much. I've learned how to just express myself in front of large groups of people, as well as, of course, the clinical knowledge and everything behind medicine.
What are your plans after graduation?
I would like to complete a residency program to increase my knowledge to become a clinical pharmacist.
Our booth is Remember the Ribbon. It's a SNAFA initiative, and its importance is trying to educate different communities around Monroe, West Monroe, and Louisiana about the stigma and stereotypes placed upon HIV and AIDS patients. So we try to provide some information to kind of clear up some of those stereotypes or misinformation.
How'd you get interested in pharmacy?
Pharmacy has been a big passion of mine. Mostly it's kind of like a personal reason. I had some addiction within my family, and I wanted to kind of learn all I could about medication management to try to help educate patients that may be suffering and struggling with addiction.
What have you learned at ULM?
I have learned a lot. I don't even know where to begin, but yeah.
Tell us what your plans are after graduation.
Hopefully after graduation, I will continue working for my current employer, Carti Cancer Institute. They are a outpatient oncology institute, and hopefully would like to be a board certified oncology pharmacist.
COVID-19 has changed the pharmacy industry dramatically. Pharmacists around the country have been the spearhead or the frontline healthcare workers for vaccinating the United States population through independent pharmacies, through chain pharmacies, and hospital pharmacies. So they've been right there in the front. Pharmacies have been screening with the COVID-19 testing across the country, as well as doing the vaccination. So I know as part of the big plan was to push out vaccines and use the pharmacy profession to get those vaccines out quicker.
My booth is the COVID-19 vaccination booth, and we are in charge of kind of describing the difference between the three vaccinations, the Moderna, the Pfizer, and the Johnson & Johnson.
Tell us, why did you enroll in pharmacy school?
I enrolled in pharmacy school because I believe it is extremely important to help others and educate people more. I really just want to see everyone healthier.
What have you learned in the College of Pharmacy?
I have learned the importance of pharmacy. Pharmacists actually play a vital role in the healthcare system, and I believe that we have the chance to make a big difference in the world.
What are your plans after graduation?
My plans after graduation is to pursue a residency and to further my education and just help people.
I'm with the COVID board, and it's important that we all get vaccinated so that we stop the spread of COVID and we can get back to normal as quickly as possible.
Tell us, why did you enroll in the College of Pharmacy?
I enrolled in the College of Pharmacy because of my grandparents. My grandfather has a lot of pre-existing conditions, and just the way that he's able to manage his own medicine really made me want to get started and helping other people manage their medicine.
What have you learned?
A lot. How to get people involved with their health, how to get people involved with their other family's health, and make sure that they're doing what they need to do to keep themselves healthy.
What are your plans after graduation?
I want to stay in retail pharmacy. I love retail pharmacy. I get to meet and greet all the community members and form relationships with them and get to know them all.
Our booth is mental health awareness, and it's important because we want to end the stigma surrounding mental health in the community and encourage seeking help.
Tell us, why did you want to become a pharmacist?
Because I watched maintenance meds save a lot of lives in my family. My dad has diabetes and high blood pressure. My sister has diabetes, and I wanted to be a part of the process of creating those meds.
What have you learned at ULM?
Oh, all kinds of things. I've learned about patient care. I've learned about the stuff that goes into making medications, and I've learned how to be a better person overall.
What are your plans after graduation?
The recent pandemic has gotten me really interested in infectious diseases, so I want to pursue a residency in infectious diseases.
So our booth is a mental health awareness board, and it's through the Student National Pharmaceutical Association. And we're basically just trying to bring awareness that mental health is a problem that should be talked about, and then we're trying to end the stigma about it and open the conversation.
What role do pharmacists play in mental health?
So the role that we play is we have clinical pharmacists that look at the medications that you take, and we're the experts on the medications that you take. So we can figure out interactions, or if you have any side effects, we can also let you know that the side effects are coming from those medications. If you take it, then you'll expect these, and just keep on taking it because it's going to help you with your mental health at the end of the day. So
how did you get interested in pharmacy?
So I got interested in pharmacy just every time I go to the pharmacy in like Walmart or CVS, I'll just pick up my medications, and like if I'm curious about the medication, they like know everything and they'll tell me everything I need to know and how to take it. And so I was just interested about that, and I also just love memorizing stuff, and there's so many medications out there that I just thought it would be a good profession for me to take.
What are your plans after graduation?
So I plan to pursue a residency, and after that I want to specialize in oncology actually, and hopefully if my life works out, I'll be in a hospital being an oncology specialist.
Our booth is Generation RX, and we are focused on letting the community know the importance of prescription and non-prescription drug misuse and abuse.
How did you get interested in pharmacy?
I chose pharmacy because I have had a lot of family that has really focused on medications and the importance of it, and I think that it is really important to let the community know how important it is to maintain medication proper use.
What have you learned at ULM?
At ULM, I have learned to be the best that I can. The smaller classes has really helped with teacher engagement and allowing us to become the best pharmacists that we can be.
Our booth is Tobacco is Wacko, and it's important because it tells of the dangers of tobacco to you and to those around you.
Why do you want to be a pharmacist?
I always really liked science and math, and pharmacy is a really good combination of both, and it lets you be able to go out and help the community.
What have you learned at the ULM College of Pharmacy?
I learned a lot. I learned a lot about responsibility and how to handle stressful situations.
What are your plans after graduation?
I'm not sure if I'd rather own a pharmacy or if I'd rather be a clinical pharmacist just yet, so I'm still thinking about doing a residency.
Our booth is Tobacco is Wacko, and you should stop smoking because it kills 20% of people in America.
Why do you want to be a pharmacist?
I've worked as a pharmacy technician in a hospital for 10 years, over 10 years, and I love it, so I was going to stay in the profession.
What have you learned at the ULM College of Pharmacy?
Probably like how to manage stress, stressful situations. I've learned a lot of leadership skills and abilities.
What are your plans after graduation?
I plan to work at the hospital, and I enjoy working at a hospital and possibly doing some type of clinical pharmacy at the hospital.
Pharmacy professional school itself is 4 years, but prior to that you have to have a minimum of 2 years of pre-professional training at the college level. So after high school you can go to whatever college you want to and get your pre-professional courses just like you would for medical school. Most of our students can get through after high school in about 6 years. Some of them do it in 7, and a small percentage of our students have BS degrees or BA degrees prior to coming to pharmacy school. So it's between a 6 and an 8 year program to get in, and then a lot of students go on to specialty training afterwards in the form of residencies and fellowships.
Our booth is the Over-the-Counter Medication Safety Board, so we're educating on how over-the-counter medications can be dangerous if taken inappropriately, so it's important to read the label and take them as directed.
Why did you want to become a pharmacist?
Well, in high school I really fell in love with chemistry, and I also love interacting with people on a daily basis, so I found that pharmacy is a perfect combination of those two things.
What have you learned at ULM?
I've learned a lot about the field of pharmacy in general at ULM. So I've learned that pharmacy is a lot bigger of a profession than I even thought coming into pharmacy school. So it's much more than just dispensing and counting tablets in the pharmacy.
What are your plans after graduation?
So right now, my plan is to pursue profession in retail pharmacy because that's what a lot of my experience is in right now.
Start off by saying I'm from Houma, and then tell me why you got into pharmacy. I'll hold it. I've got it. Look at me.
Okay. I'm from Houma, Louisiana, and I got into pharmacy because it's one of the most accessible healthcare professionals so that I can serve underserved communities more easily. I've learned so many things. I've learned more about the pharmacy profession and that we're more about doing clinical services rather than just being a pharmacist behind a counter counting pills. And I've gotten a lot of clinical knowledge, and I've done several health fairs in the community to further enhance what I've been learning in the classroom out in the community.
What are your plans after graduation?
After graduation, I plan to do a residency, which is some extra training that pharmacy students can do and pharmacists to enhance our clinical knowledge even more and work in more advanced practices and more specialized practices.
I went to LSU down here, and I had really liked chemistry and all the things that you can do with a pharmacy degree. So I moved on up to ULM, got my PharmD there. I'm in the process of getting my PharmD there.
What are your plans after graduation?
I would like to go on a residency track. Basically what that means is some extra training to hold a more advanced practice position.
I decided to enroll at ULM because both of my uncles went there and they only had good experiences from it, and I've agreed about the same thing. I really like how it's a small university and everyone's such a close-knit community, and I've had a lot of people to rely on, depend on, and also been a mentor to as well. Our booth is on antibiotics, and I'm just making the general public more aware about antibiotic resistance and how to stop the prevention of it. And it's basically just a bunch of common illnesses, and we kind of discuss whether it's actually caused by bacteria, viruses, or other causes, and then whether or not they can be treated with antibiotics and whether it would be appropriate to do so.
What have you learned in the College of Pharmacy?
We've learned so much here throughout the past 3 years. I'm now a P3, so this year we actually got into counseling, more patient interactions. I've been able to go out into the world and actually go on rotations, interact with real patients, with the medicine teams, doctors, prescribers, and like a really good sense of intercollaboration with the health profession.
What are your plans for college? What are your plans after graduation?
After graduation, I'm hoping to pursue a residency. I would be the most interested in probably something in ID and antibiotic stewardship or critical care.
The pharmacy school at ULM is the only state-supported school, and we supply a good number of pharmacists to the state of Louisiana. So without that school up there, we would have a shortage of pharmacists in the state. And it's kind of a hidden secret. We've put out very good students, like I said, that are highly sought after, and so we would like the public to know that we're there and that we're always advocating for their health. And we do a lot of community service things both in Monroe, Shreveport, New Orleans, and smaller communities to support the health care of the state of Louisiana.
The best thing about the College of Pharmacy is the professors and everything they offer to us. They are super accessible and super personable, and they are here to help us, and that has been a super eye-opening and awesome experience for me because they are pharmacists and they want us to become the best pharmacists out there. So just having them by our side through everything has been so awesome.
The best thing about the ULM College of Pharmacy is that we have an awesome faculty who's willing to work with the students and help us become better clinicians.
The best thing about ULM College of Pharmacy is definitely the family aspect of it, to the faculty, to the preceptors, to the students. We're all one big family and we want everyone to succeed.
I would recommend the ULM College of Pharmacy because it's a family. We are all called a family because we're a pharmacy family. We just come and connect together.
The best thing about ULM is smaller class sizes. It offers the students the ability to have a more personal relationship with your faculty, which I think is really important for student success. You get to build that relationship with your faculty, and I think it helps improve what you actually learn.
I would recommend the College of Pharmacy to students because I believe that we have a big role in patient education and reaching out to those who are underdeserved.
The best thing about the College of Pharmacy is that they're going to push you as hard as they can to be the best pharmacist that you can be.
People interested in pharmacy should come to ULM because it feels like a family. The faculty really care about your success and they'll help get you where you want to go.
So students interested in pharmacy should come to ULM because you're not just a number. We all really care about you. If you have a problem, just talk to your faculty, and the students are really, really supportive also. And so I just really like the student organizations. They're always open, and we have a lot of socials, and so we're always there for you guys. So yeah.
Students interested in entering pharmacy should go to ULM because it gives you a well-rounded experience and will allow you to be in situations that are difficult, but you'll be able to handle them and you'll come out for the better of it.
Students interested in pharmacy should come to ULM because they focus on a lot of personal growth and development and leadership skills and teach you how to interact with people and emotions, and it's a really good opportunity.
Students interested in pharmacy should come to ULM because ULM Pharmacy is really a family. The faculty is super approachable, and it really makes the whole experience really great.
I would totally recommend to all students who are interested in pharmacy to attend the School of Pharmacy at ULM. We're definitely very supportive of one another. We call each other a family. We're a big family in the pharmacy community, and we all work together very well. It's a really great support system, and we get a very good education as we're funded by the state.
The best thing about the College of Pharmacy is the people there. The faculty are awesome. They care about us so much. They want to do everything that they can to help us. And the students rise to every occasion, every challenge that this year is thrown at them. I couldn't be more proud to be a part of it.
How can people get more information?
We have our website at ulm.edu. You can go there to the College of Pharmacy part of that website, and there's information there about our pre-pharmacy programs. There's information about our professional program. We also have a toxicology school within our college and a PhD program where we train PhD students in pharmacology, medicinal chemistry, and pharmaceutics. All that's on the website. And we also have some combined degrees now where students can go and get a PharmD degree, the Doctor of Pharmacy, with an MBA if they have a interest in maybe in management. And we just started a combined PharmD PhD program, so students can do that also. So we have a lot of opportunities for students, and they can go on our website, and all that information's there. And if it's not there, there's contact information on there where somebody in our recruiting office can reach those students and give them more information.